I'm Dr. Shantanu Tandon. I'm a senior consultant and airway specialist in the Department of ENT at Sakra Hospital. So I'll be talking today about swallowing problems, especially in old patients. Now we run a swallowing clinic where we deal with all kinds of problems associated with it. But why talk about old age first? Now, to make sure that we swallow properly, not only do we need to use the muscles of our mouth to chew and push the food back, but we also need the muscles of our food passage to work in tandem to push the food particles or the bolus down. Now, if there's a problem in any of these areas, there will be a problem in our swallowing. Now, with age, the muscles of our food passage, like a lot of our other muscles, can start becoming weak, and they might start working in an uncoordinated manner. Now this will give rise to a difficulty in swallowing, a feeling that the patient has to take a lot more time to swallow the food, or it just feels like they have to constantly keep exerting more and more force. Now the challenge is, this can be age related, but this can also be due to some slightly more complicated conditions such as strokes or even cancers. And it's always important that we can differentiate as early as possible between these different causes. So one of the most important ways of assessing these patients is, first of all, bringing them to a clinic, because the longer we wait, the more chances that we'll miss important problems.